So despite executive orders from U.S. President Donald Trump affecting South Africa, data from the District Health Information System shows a significant drop in HIV infections in Gauteng between 2020 and 2024. Among the individuals aged 15 to 24 years, infections decreased by 2.9% in 2020. To unpack these numbers further, we are now joined by Nichola Lutchman, who is an assistant director for sexually transmitted infections, high transmission areas and pre-exposure prophylaxis at the Gauteng Department of Health. A very good morning to you, and thank you so much for making time for us this morning, Nichola. So what can we attribute this decline to?
So good morning, everyone. Yes, we were actually quite impressed or excited to see the decline. And like you rightfully mentioned, it didn't take the department alone to bring this numbers down. So what we've done is we ensure that we work through a multi-sectoral approach to HIV prevention program, even our treatment program, and working very closely with our developmental partners, our civil society, and other private partners. We actually ensure that we make a noise about this. We reach out to more people, conduct more outreach activities, even intensify our facility-based interventions. And I think this, for the department, this is one of the platforms we're also utilizing so that we create an awareness and a demand for services so that people are aware that what services are available, how they can protect themselves, and even if they are infected, whether it's STI or HIV, where they can access treatment and what treatment they can access.
Yeah. And with regards to working with certain organizations, speak to us about the role that some of these organizations are playing to help the Department of Health to reach these particular figures, and also, once again, considering that we are noting this decline.
So, like I said, as a department, we were not able to do this alone. Our developmental partners came through to assist in terms of, supporting what we've had already in terms of providing services for HIV/AIDS, STI, and TB for our key and vulnerable populations, more specifically focusing on youth, also focusing on men, going out to our townships, our informal settlements and hostels, which has been a mandate from our Gauteng Departments of Health, MEC, so that we reach the most unserviced population in Gauteng. We know that they are at risk of becoming infected for HIV and other STIs because of the economic, challenges, whether it's a behavioral challenge. And this is what we're saying. We are going to the community. We are taking out the interventions to our community so that they can have easy access. We know people are reluctant to visit facilities. Therefore, we had no choice but to say if we need to see this HIV incidence come down, we need to ensure that people access more of these services, whether it comes to condom use, showing them how to use a condom, educating them the proper use of a condom, and encouraging them to utilize it every time that they have a sexual encounter, from knowing your HIV status, getting tested for HIV. If you are HIV positive, we know we have a huge antiretroviral program in South Africa and Gauteng as a whole. And we are saying that people who are infected with HIV need to actually get to a facility, engage with the clinician, so that they can provide them with the best possible care and treatment where they adhere to treatment. Currently, we are experiencing a challenge where people have been infected with HIV. However, they have disengaged from the program, and we are on a mission to ensure that we re-engage these clients back into care so that their viral load is suppressed. Once someone's viral load is suppressed in an HIV positive client, we know that they limit the transmission of HIV, especially to their sexual partners. In addition to that, working with other organizations and partners, we ensure that we reach out to our taxi association through Centago. We know that we're having a challenge with men accessing healthcare services at our facilities, or just in general healthcare. So what we're saying is we're going to go out, work with Centago, work with the Taxi Association, where men congregate, so that we can get more people, more men on treatment, know the HIV status, know the signs, know the symptoms, and take care of their health.
Yeah, and I want to go back to this point. Starting in this interview, the introduction, we're speaking about what's happening with the United States and the decision that has been taken by by the Trump administration. This is now in relation to funding and aid. We know the decision that has been taken now to reverse that particular decision in terms of PEPFAR aid. But do we have a strategy as a country, and maybe even as a province, that what happens if that money is no longer available, knowing very well the impact that it could have on the organizations that have been assisting the Department of Health to report such figures?
Okay, yes. So definitely, PEPFAR had a vital role in assisting South Africa as a whole and Gauteng as a whole to ensure that services are in place and we reduce these infections within our community. And with the stop work order from Trump, it has had some impact on the services. However, we are not saying as Department of Health the services are non-existent now that PEPFAR is out. We are saying we are continuing with services. We are working with what we have, and we are working on contingency measures to ensure that we redirect clients to our facilities, that we utilize what we have on hand, and come up with a strong contingency transition plan so that we re-engage people on treatment who have disrupted treatment and also other prevention methods. As you're aware that, most of our facilities in Gauteng province, we are also targeting our youth, which is a vulnerable population. All our facilities where we have available are adolescent and youth-friendly services. That is your youth zones. We are saying to youth, yes, we know that you are reluctant to come through for services. However, there are services available where we have an express queue or fast queue, if you may call it. You come through and get those services. So definitely we have seen some, decrease or some impact in terms of PEPFAR's withdrawal from the country. But as a province, as Gauteng province, as South Africa, we know that we will come up with a contingency plan, and the services are still available. They are available, but there has been some impact on it as well.
Yeah. And finally, the Human Science Research Council released their own data last year around HIV prevalence in the province. And they, of course, were looking between the year 2017 and 2022. But even then, they noted a slight decline from 12.1% in 2017 to 11.9% in 2022. But one of the points that they raise is that there's significant gaps in treatment adherence and safe sexual practices that were seen among the same age group. What are your research data indicating when it comes to that particular aspect that is highlighted here by the Human Science Research Council?
Yes, so I think that is one part of surveillance that we rely on, especially on the behavioral study aspect. So this also gives us more insight into what people are thinking, what people are doing, and what are the gaps that as a department we need to close. So in terms of treatment, adherence, it does become challenging. We know that we've got people that are working or traveling long distances. They tend to miss the appointment. Life happens. They forget to take their medication. And what we are pleading and our message across is that once you're on ARVs, it's lifelong. And we see that 20 years down the line, ARVs has been, a lifesaver. And in terms of people living with HIV, they are living more productive lives and a longer life. So in terms of adhering to treatment, we know that once you adhere to treatment, you take your treatment every day, your viral load is suppressed. So this is basically saying that your virus may be undetectable and it prohibits you from actually spreading the disease. However, we are not out of the red in terms of condom. Condom use still remains the mainstay for HIV prevention in the country and anywhere around the world. Not just HIV, for STIs as well, other STIs, and as well as your unintended pregnancies or unplanned pregnancies. So even though people may be adherent to treatment, their viral load is suppressed, we're still encouraging people to utilize the condoms correctly and consistently consistently. And we know that, STIs are predominantly spread through sexual intercourse. So by you having multiple sexual partners, not knowing your HIV or your partner's HIV status, and having unprotected sex, it is going to cause an increase in in becoming infected. And therefore, we are pleading to the public, you know what, engage with us. You see our mobiles, you see our team on site. Please come through us. We can, give you more information and how you can receive more assistance with regards to ensuring that you are protected.